Welcome friends, I'm Dr. Rajsree Nambudripad, and today's video is all about cholesterol and how to prevent heart disease. Did you know that heart disease is the #1 cause of death worldwide? In the United States, almost 700,000 people die of heart disease every year. We're all familiar with the classic symptoms of a heart attack, which include chest pain, pressure, and shortness of breath. But did you know that 45% of heart attacks are silent and have no symptoms? When we think of heart disease, we often think of cholesterol. Is it the enemy when it comes to your heart? There's a lot of fear surrounding cholesterol. So should we be scared of cholesterol? So many people consider cholesterol to be the #1 villain when it comes to heart disease. Just hearing the word cholesterol makes some people think of plaque in their arteries. But did you know that our body actually needs cholesterol? Cholesterol is a vital part of your cell membranes. Every one of your nerve cells has a fatty membrane sheath that's made from cholesterol. Did you know that our brain is actually 60% fat? And it actually requires cholesterol. Cholesterol is also needed to make bile, which is made by your liver and stored in your gallbladder. Bile plays an important role in breaking down fats from your diet, and it helps you to absorb nutrients from your food. Cholesterol is also the building blocks of one of the most important vitamins in your body, vitamin D. Finally, without cholesterol, we wouldn't be able to make our hormones. Every cell membrane in your body is the docking station for thousands of chemical messengers that communicate with your cells. And found within these cell membranes is cholesterol. Without cholesterol, your cell membranes would be stiff and rigid. So it's the cholesterol that brings the flexibility and fluidity to our cell membranes. Now let's talk about your hormones. Cholesterol is the building blocks for your steroid hormones. This includes the sex hormones, which include testosterone, as well as estradiol, which is estrogen. Cholesterol is also needed to make cortisol, which is the stress hormone made by your adrenal glands. What's amazing is, as you can see in this diagram, the structure of cholesterol is so similar to the structure of these hormones. So I want to emphasize that you actually need cholesterol to have healthy hormone levels. Cholesterol is also converted to cholic acid, which is bile acid. Once again, look at the similarity in the chemical structures. Without bile, we wouldn't be able to digest fats in our diet or absorb fat-soluble vitamins from our food. Next, cholesterol is used to make cholecalciferol, which is the amazing vitamin D3, which is so essential for our bodies. Vitamin D plays so many important roles in our body, from our immune system, to our hormone health, to our metabolic health, to cancer prevention, and even our bone density, that we often refer to it as the longevity hormone. Once again, isn't it amazing how the chemical structure for cholesterol is so similar to the chemical structure of vitamin D3? Even the word cholecalciferol comes from the word cholesterol. So there's a lot of nuances when it comes to cholesterol and heart disease. As you can see, not all cholesterol is bad. And today I'm going to go over what are the real root causes of heart disease. Spoiler alert, it often has nothing to do with cholesterol. Now that we've established that cholesterol is vitally important for your body, let's talk about where it comes from. Cholesterol production is so important that your liver and intestines make about 80% of the cholesterol that you need to stay healthy. Only about 20% comes from the foods that you eat. For example, if you eat an egg, your body will absorb about 200 milligrams of cholesterol from the egg yolk. But your liver and intestines will produce an additional 800 milligrams of cholesterol every day. This is why dietary cholesterol plays a small part in your overall blood cholesterol levels. So there's no reason to be afraid of eating the whole egg, including the yolk, which is the most nutritious part of the egg. Cholesterol is a type of fat, so it doesn't dissolve in our blood, which is like water. So it has to be transported by tiny particles called lipoproteins. Lipoproteins are a combination of fats and proteins, and their job is to transport cholesterol and triglycerides to tissues in your body. The first lipoprotein made by the liver is the fattest, and it's called chylomicrons. And the reason it's so big is because it's packed with triglycerides. Once the chylomicron drops off triglycerides in various tissues in your body, it becomes smaller and more dense, and we call it a very low-density lipoprotein, or VLDL. The VLDL then drops off more triglycerides, and it turns into an intermediate-density lipoprotein, or IDL. Similarly, the IDL then turns into an LDL, or low-density lipoprotein. Finally, the LDL turns into an HDL, or high-density lipoprotein. You may have heard of HDL being the good cholesterol, because it brings cholesterol from your tissues back to your liver. Now let's talk about good versus bad cholesterol. As I mentioned, HDL is the good cholesterol. It brings cholesterol back from tissues to your liver. So HDL has a protective effect on the heart, and it correlates with exercise, genetic factors, and even hormones. For example, in women, estrogen raises the HDL. Next, we have LDL, which is often considered the bad cholesterol because it carries cholesterol to your tissues. But today I'm going to explain why LDL is actually not the bad cholesterol. It's the so-called bad cholesterol. If your LDL particles are large and fluffy, they're actually not bad cholesterol. The true bad cholesterol is the small dense LDL or the oxidized LDL, which is like rancid LDL. So what determines how much small dense LDL and oxidized LDL you're going to have? It's determined by your diet as well as genetic factors. Stay tuned because later in this video, I'm going to go into great detail on how you can improve your cholesterol through your diet. Now, if we compare two people that have the same LDL result on their blood test, but the first person has pattern A, meaning they have the large fluffy LDLs, and the second person has pattern B, meaning they have the small dense LDL, the person with the pattern B is going to be much higher risk for heart disease. As you can see, when it comes to LDL, the size of the particles really matter. The large fluffy LDLs carry cholesterol to your tissues, but they just float peacefully through your arteries. This is why the large fluffy LDL do not seem to increase the risk of heart disease. On the other hand, the small dense LDL and oxidized LDL, which are the true bad cholesterol, are very inflammatory. We can think of them like a bullet. They have a way of injuring and penetrating the endothelium of our arteries to cause plaque buildup. Once this happens, it alerts your immune system, and it attracts immune cells like macrophages, which come in and can deposit fibrin, which can cause stiffening of the arteries. When it comes to your diet, saturated fat will raise your LDL, whether it's from red meat, dairy products like butter or cheese, or even coconut oil. But what's really a problem is the foods that raise the small dense and oxidized LDL. This includes processed foods, as well as foods with high amounts of sugar, and foods that are made with bad oils like trans fat and hydrogenated oils. Stay tuned because later in this video, I'm going to talk about all the different types of fats in our diet, and I'm going to grade them from best to worst. Now let's talk about triglycerides. I call them the forgotten lipid because a lot of people underestimate the importance of triglycerides. Triglycerides are made when you combine one glycerol with 3 fatty acids. Your liver makes triglycerides when it's signaled by a hormone called insulin that's made by your pancreas. When you eat a lot of sugar, carbs, or drink alcohol, this tells your pancreas to make more insulin, which then tells your liver to make more triglycerides. These are the types of foods that'll raise your triglycerides. This includes desserts, processed carbohydrates like chips, and even grains like breads, pastas, and cereals. Because alcohol turns into sugar, it can also raise your triglycerides. Finally, soda, which is loaded in high fructose corn syrup, can really raise your triglycerides. Currently, half the US population suffers from a metabolic condition called insulin resistance. If you're carrying abdominal fat, this could be a clue that you have insulin resistance. People with insulin resistance have tissues that stop listening to insulin, so their pancreas responds by increasing production of insulin. The problem is insulin promotes inflammation and weight gain. It can also lead to prediabetes as well as diabetes. It can cause high triglycerides, fatty liver disease, and most importantly, heart disease. A big takeaway from today's video is that insulin resistance can be a big root cause of heart disease. I have a whole video dedicated to insulin resistance where you can learn about how to reverse it through diet and lifestyle, and I'll put the link in the description below. Now let me explain what are some of the real root causes of heart disease. Inflammation is one of the biggest root causes of heart disease. In the presence of inflammation, cholesterol is more likely to stick to your arteries. As we talked about, insulin resistance can cause inflammation, which can lead to heart disease. Genetic factors can also put you at a higher risk of heart disease. If you have a first-degree relative like a father or brother who suffered a heart attack at a young age, like in their 50s, then we have to be much more proactive about preventing heart disease. Exposure to toxins like cigarette smoke can cause damage to the inner lining of your arteries. We call this endothelial damage, and this can definitely increase your risk of heart disease. Believe it or not, if you simply lead a sedentary lifestyle, this can increase your risk of heart disease. Never underestimate the power of stress when it comes to heart disease. When you're under chronic stress, your adrenal glands produce higher levels of the stress hormone called cortisol, and this can cause inflammatory changes throughout your body. Cholesterol is the final risk factor for heart disease. But as you can see, there are many other big root causes of heart disease. This is why we sometimes see people with normal cholesterol who suffer a heart attack. And we also see people with very high cholesterol who never develop heart disease. Inflammation in your gut microbiome can be a big root cause of heart disease. That's because inflammation in your gut lining can disrupt the integrity of the intestinal mucosal barrier. We call this leaky gut, and it can cause systemic inflammation, which can affect your coronary arteries. Unfortunately, the standard American diet, which is high in sugar, processed foods, and inflammatory oils, can change the types of bacteria that grow in your gut microbiome. These kinds of foods can promote the growth of bad bacteria, and we call this dysbiosis. The bacteria in your microbiome are powerful because they produce metabolites. In dysbiosis, we see increased production of toxic metabolites like trimethylamine oxide or TMAO, which has been linked to an increased risk of heart disease. Inflammation in your oral microbiome, which is your teeth and gums, can also be a root cause of inflammation in your body. By having good dental hygiene and by brushing and flossing regularly, you may actually be protecting yourself from heart disease. When it comes to your blood tests, the Standard Lipid Panel does have some limitations. And later in this video, I'm going to talk about how an Advanced Lipid Panel can often be more helpful. Normal total cholesterol is under 200. But generally, I don't find total cholesterol helpful because people with high HDL, which is the good cholesterol, will often also have high total cholesterol. Normal LDL is under 100. But remember, LDL is the so-called bad cholesterol. A standard lipid panel doesn't distinguish if your LDL particles are large and fluffy, or if they're small and dense or oxidized, which are the true bad cholesterol. HDL is the good cholesterol. Remember, it carries cholesterol away from tissues back to your liver, and higher the HDL the better. So a normal HDL is over 40 in a man or over 50 in a woman. Having a low HDL can be a risk factor for cardiovascular disease. Next, we have triglycerides. According to most lab ranges, normal triglycerides is under 150. But for optimal metabolic health, I recommend getting your triglycerides under 100. Remember, triglycerides correlate with sugars and carbs in your diet. The Standard Lipid Panel is just one piece of the puzzle, so I like to look at the whole picture when it comes to a patient's labs. The high-sensitivity C-reactive protein is a marker of inflammation in the body. And remember, inflammation is a big root cause of heart disease. Then I look closely at the fasting insulin, glucose, and hemoglobin A1C, which is a marker of the blood sugars for a 3-month period. Remember, insulin resistance, prediabetes, or diabetes can increase your risk of heart disease. Homocysteine is an inflammatory amino acid that we can measure on your blood work. High homocysteine has been associated with increased risk of heart attack and stroke. The good news is we can lower your homocysteine by supplementing with methylated B vitamins. I also look closely at the liver enzymes, which include ALT, to see if there's any evidence of fatty liver disease. If you have high homocysteine levels, this could be a clue that you have a mutation in a gene called MTHFR, which stands for methyl tetrahydrofolate reductase. Mutations in the MTHFR gene can affect methylation and detox pathways in every cell of your body. And if untreated, it's associated with an increased risk of cardiovascular disease. I have a whole video that explains the MTHFR gene in great detail, and I'll put the link in the description below. Let me give you an example of how I like to look at the whole picture when it comes to my patients. Gina is a 47-year-old woman with a total cholesterol that's high at 234. Her HDL, or good cholesterol, is absolutely amazing at 105, so I'm going to give her 2 gold stars for this. Her triglycerides are also excellent at 68, which is well below 100, so I'm going to give her another gold star. Her so-called bad cholesterol, or LDL, is high at 115. The good news is her inflammation marker, which is the high-sensitivity C-reactive protein, is under 0.3, which is extremely low, so I'm going to give her another gold star for this. Gina's fasting glucose is excellent at 84, and she has no insulin resistance because her fasting insulin is ideal at 6. Her hemoglobin A1C, which is our marker of her sugars for the last 3 months, is outstanding at 4.9. Anything under a 5 deserves a gold star. Her liver enzyme, or ALT, is perfect at 15, and her homocysteine is ideal at 6. Gina does her best to eat a clean, whole foods diet, and she exercises regularly. She also has no family history of heart disease. So am I worried about Gina's high total cholesterol and LDL? And would I put her on cholesterol medication for this? Absolutely not. Now let's look at Sean. Sean is a 48-year-old man with a total cholesterol that's high at 234, which is the same as Gina's total cholesterol. So let's look at the whole picture. Sean's HDL, or good cholesterol, is low at 34. His triglycerides are high at 225, and his so-called bad cholesterol, or LDL, is also high at 162. Sean has a lot of inflammation in his body because his high-sensitivity C-reactive protein is high at 6.3. He has a high fasting glucose at 115, which means he has prediabetes, and his fasting insulin is really high at 25, which indicates insulin resistance. Sean's hemoglobin A1C is also high at 5.9, and his liver is inflamed because his ALT is elevated at 45, so this could indicate fatty liver disease. Finally, Sean has an elevated homocysteine at 14. Sean is also overweight, he leads a mostly sedentary lifestyle, and most of his food is packaged or processed. So am I worried about Sean? Absolutely. But can we turn this around with diet and lifestyle? Yes, we can, and that's what I'm going to present later in this video. One important relationship to look at is the triglyceride to HDL ratio. Your goal is to have a ratio of under 2:1. Gina's triglycerides are only 68, and she has an amazing HDL of 105. So her triglyceride to HDL ratio is only 0.65, which is excellent. In Sean's case, he has a high triglyceride of 225 and a low HDL of 34, so his triglyceride to HDL ratio is 6.6. Anytime the ratio is over 2:1, it means that there are underlying metabolic issues and that the person is carbohydrate sensitive. It turns out that Sean has the metabolic trifecta that I often see in patients. The 3 things I look for are a high fasting insulin, high triglycerides, and high liver enzymes, or ALT, suggestive of fatty liver disease. The good news is all 3 of these problems is correctable with the same type of diet. The key is to reduce carbs and sugars in the diet and to do regular exercise. I have a video on fatty liver disease that explains in detail the diet to reverse this type of metabolic trifecta, and I'll put the link in the description below. Now let's talk about the Advanced Lipid Panel. It's often a lot more helpful because it tells us your true bad cholesterol, which is the small dense LDL and the oxidized or rancid LDL. We can also measure your Lp(a), which stands for lipoprotein A. Lp(a) is a genetic risk factor, and if it's elevated, it makes your cholesterol a lot more sticky or atherogenic. People with a high Lp(a) are much higher risk of developing heart disease, so we have to be even more proactive to help reduce their risks. Finally, the Advanced Lipid Panel can tell us your omega-3 score. This helps us figure out how much fish oil you should be taking to reduce inflammation in your body. The great news is most of these advanced lipid tests are now available through standard labs such as Quest Diagnostics. Let's return to our friends Gina and Sean. I ordered an advanced lipid panel for both of them, and this is what I found. Although Gina had a high LDL, or so-called bad cholesterol, it turns out that her true bad cholesterol, which is the small dense LDL and oxidized LDL, are actually in the normal range. Her Lp(a) is nice and low, and she has an excellent omega-3 score. In contrast, Sean has a high small dense LDL as well as oxidized LDL. His Lp(a) is high, which gives him a genetic risk factor for heart disease. Finally, his omega-3 score is really low. I want to point out that both Gina and Sean had the exact same total cholesterol of 234. But Gina is low risk for heart disease and Sean is high risk for heart disease. This is why it's so important to do a more thorough assessment and to look at the whole picture. This brings me to my patient Kevin. One day, Kevin comes to my office and asks me, "What's my risk of heart disease?" Let's calculate it. There's an objective way to look at all your numbers, and it's called the ASCVD Risk Calculator. This is a tool to calculate your 10-year risk of developing atherosclerotic cardiovascular disease. Anyone can actually do this on your own. You just go online and enter your gender, age, total cholesterol, HDL, blood pressure, and whether or not you have diabetes. This is how we interpret the results. If your ASCVD risk score is under 5%, then you're low risk for heart disease. Intermediate risk is between 5 to 7%. Borderline risk is 7.5 to 20%. If your score is over 20%, then you're at high risk of developing heart disease. Kevin's ASCVD risk score came back at 10%, which put him in the borderline category. To figure out if he already had heart disease, I recommended that we scan his heart. So I ordered a coronary artery calcium scan. This is a CT scan of the heart that looks for calcium in each of the coronary arteries. As you can see here, the calcium shows up white, so it's very easy to pick up on this type of scan. The only downside is, like all CT scans, there is radiation involved, so I recommend my patients take glutathione and vitamin C for at least a week before and after the scan to help their body handle the radiation. Now let's review Kevin's results. His right coronary artery had 0 calcium. His left coronary artery and his circumflex artery were also clean with 0 calcium. But unfortunately, his left anterior descending artery had a calcium score of 92. This particular artery, called the LAD, is often referred to as the widowmaker because a blockage in this artery can cause a massive heart attack and sudden death. When we see calcium in one of the arteries, it means that plaque has already built up there. So unfortunately, Kevin already has heart disease. So as you can see, a coronary artery calcium scan is really helpful because if it's positive, it means that the person already has coronary artery disease. This is when we want to be really proactive. So I refer Kevin to a cardiologist for a stress test, and I start him on a baby aspirin every day. When we know a person already has heart disease, studies show better outcomes when the LDL is lowered more aggressively to under 70. This brings us to the topic of cholesterol-lowering drugs like statins. Statins work by inhibiting an enzyme called HMGA-CoA reductase in the liver. This inhibits cholesterol production. We know statins significantly lower LDL, but does that mean less heart attacks and strokes? This is where we have to distinguish secondary prevention versus primary prevention. Secondary prevention is when we already know the person has heart disease, so they've already had a heart attack or stroke, or they have a positive calcium scan. In these cases, statins have been shown to improve outcomes by preventing further heart attacks. Now let's talk about primary prevention. This is when a person does not have heart disease and we're trying to prevent heart disease. This is where there's a lot more debate in the efficacy of statin use. There's a website called thennt.com, which stands for the number needed to treat.com. It's run by a panel of board-certified physicians who analyze all the research data available and calculate the number of people that you would need to treat with a statin to prevent a heart attack or stroke. What's interesting is in primary prevention, the number needed to treat is 104 people to prevent one heart attack or 154 people to prevent one stroke. So there's a big difference in the efficacy of statin use in primary prevention versus secondary prevention. Statins also have potential side effects. Some people experience muscle soreness and weakness when they're on a statin. This is because of the impact of statins on the mitochondria, which I'm going to talk about. In fact, up to 1 in 10 people can experience muscle pain on statins. There's also a small risk of developing diabetes that's seen more commonly in postmenopausal women. The mitochondria are the energy powerhouses of our cells, and they generate something called ATP, which is the energy currency of our cells. On the left, we have a healthy mitochondria that can generate a lot of ATP. Cholesterol-lowering medications like statins deplete a very important coenzyme in the energy pathway called CoQ10. Without CoQ10, your mitochondria won't be able to make as much ATP. And this is what causes a lot of the side effects that we see on statins, like muscle soreness and weakness. We call this statin-induced myopathy. The great news is that research shows that when you supplement with CoQ10, it can help prevent a lot of these statin-induced symptoms, and it can help reverse statin-induced myopathy. So whenever I prescribe statins, I advise my patients to also take 300 milligrams of CoQ10 per day. A big takeaway of today's video is that if you are on a statin, it's important to supplement with CoQ10 to keep your mitochondria healthy. Many of you may be wondering, how can I lower my cholesterol naturally and avoid medications? The great news is there's a lot you can do. First, we're going to go over the diet in great detail, and then we're going to go over supplements that can be helpful in preventing heart disease as well as lowering cholesterol. Now, should you go on a low-fat diet to reduce your cholesterol? The answer is absolutely not. Low-fat diets end up being higher in carbohydrates that are inflammatory. Good fats can help keep you full and stabilize your blood sugar. This includes avocados and olive oil, which are a great source of monounsaturated fat, as well as wild salmon and walnuts, which have omega-3 fatty acids. What about eating foods like eggs and shrimp that are high in cholesterol? These foods are fine to keep in your diet because dietary cholesterol is only 20% of your overall cholesterol. Eggs and shrimp also happen to be low in saturated fat. And remember, saturated fat is what really drives up LDL. Eggs can also help improve your HDL, or good cholesterol. The research shows no significant association between egg consumption and mortality in the United States. My last video was on longevity, and it turns out that a lot of centenarians, who are the people that live beyond 100 years of age, eat eggs as part of their diet. Eggs are one of the most nutrient-dense whole foods made by nature. Egg yolks are a rich source of choline, which is good for your brain, liver, and eyes, and it's also a rich source of vitamin D, B vitamins, and omega-3 fatty acids. But what you eat with your eggs is probably more of an issue. I like to eat my eggs with vegetables and berries, as shown on the left. A lot of people pair eggs with bacon, toast, and a glass of orange juice. This option has no fiber, and it's going to spike your blood sugar, setting you up for metabolic issues. Now, what about saturated fat? Before I get into the nuances of saturated fat, I want to point out that saturated fat paired with sugar can be inflammatory. We often see this combination in desserts, as well as modern coffee beverages like frappuccinos. Now let's compare 3 meals that each have 25 grams of saturated fat. First, we have grass-fed beef paired with vegetables. Next, we have fettuccine alfredo, which is a pasta dish paired with a sauce made from butter and cream. Finally, we have a burger and fries from your local fast food restaurant. I give the first meal a thumbs up because grass-fed beef is much higher quality and has more omega-3 fatty acids compared to conventionally raised corn-fed beef. This meal is also low glycemic index and has fiber and antioxidants from the vegetables. For the fettuccine alfredo, I'm going to give it a thumbs down because pasta is a lot of carbs which turn into sugar. So essentially, this meal is pairing saturated fat with sugar. Finally, the burger and fries definitely gets a thumbs down because it has trans fats and it's processed with a lot of food additives and chemicals. This is why it's hard to make a blanket statement about saturated fats being good or bad. It really depends on the quality of the ingredients and how you're pairing these foods. So what does the science say about saturated fats? Based on the scientific evidence, there is no scientific ground to demonize saturated fat as a cause of cardiovascular disease. Saturated fat, naturally occurring in nutrient-dense foods, can be safely included in the diet. This means that high-quality saturated fats, like grass-fed beef or grass-fed butter, can be included as part of a healthy diet. It's important to remember that everyone is different and responds differently to saturated fats. I don't recommend overdoing saturated fats as seen in the dirty keto diet because this can cause your LDL to skyrocket. It's good to be aware that some saturated fats have their own unique health benefits. For example, grass-fed butter and ghee have butyrate, which is an anti-inflammatory postbiotic that's good for the cells lining your colon. Medium-chain triglyceride oil, or MCT oil, which is made from coconut oil, can be great brain fuel, and it promotes ketone production. Coconut oil has monolaurin, which has antimicrobial properties in the gut microbiome. Finally, as I mentioned, there's a big difference in the quality of the fats found in grass-fed meat versus corn-fed meat. It's also good to be aware that people with autoimmune disease or gut issues like irritable bowel syndrome often do better when they cut dairy out of their diet. A lot of people are sensitive to dairy, and it causes inflammation in their body. This is why I like to personalize dietary recommendations for each of my patients. The keto diet has become really popular lately, raising a lot of controversy regarding the impact on cholesterol. There's a big difference between the clean keto diet and the dirty keto diet, and to learn more about this, please check out my video, which I'll link in the description below. So which diet is the best when it comes to your heart and cholesterol? Once again, there's no single diet that's perfect for everyone. It has to be customized based on your symptoms, diagnoses, and preferences. A whole foods diet is a great start because it helps you avoid all processed food and chemicals. Those suffering from an autoimmune disease or irritable bowel syndrome often do better on a gluten-free and dairy-free diet. The Mediterranean diet has been studied extensively. The CardioPrev study looked at over 1,000 patients with established coronary artery disease. They enrolled half the patients in a Mediterranean diet, and the other half followed a low-fat diet. The study found the Mediterranean diet to be superior in reducing cardiovascular events. The paleo diet and the clean keto diet are excellent for helping those with weight and metabolic issues. For example, they're excellent at reducing triglycerides, and they can also help reverse insulin resistance, fatty liver disease, and diabetes. Finally, a more plant-based vegetarian diet can also be good for your heart and cholesterol. Diets to avoid include the standard American diet, the carnivore diet, and the dirty keto diet. Now let's review what you want to eat and avoid in your diet. You want to eat plenty of vegetables and low glycemic index fruit like berries to get plenty of good fiber, antioxidants, and polyphenols. Incorporate good fats into your diet like extra virgin olive oil, avocados, and nuts and seeds. Wild fish like wild salmon is an excellent source of omega-3 fatty acids. Pasture-raised eggs are another great nutrient-dense food. Depending on how sensitive you are to saturated fat, you may want to stick with more leaner proteins like organic chicken or turkey. Finally, legumes and whole grains are another big part of the vegetarian and Mediterranean diets. However, I put these in parentheses because if you have irritable bowel syndrome or metabolic issues like insulin resistance, you may want to minimize these categories. Foods to avoid in your diet include refined sugar. You want to avoid processed foods in order to avoid chemicals, additives, preservatives, dyes, artificial sweeteners, and other non-food ingredients. You want to avoid refined grains and flours. And many people feel better and have less inflammation when they cut dairy out of their diet as well. You want to avoid processed meats, and you want to avoid vegetable and seed oils, which I'll talk more about. You definitely want to avoid deep-fried foods, which will have inflammatory trans fats. Finally, you want to minimize your intake of alcohol because it turns into sugar in your body. Now I want to introduce you to an important concept of the omega-3 to 6 ratio. The higher your omega-3 to 6 ratio, the better it is for reducing inflammation in your body. This means you want to eat more wild fish like salmon, smaller fish like sardines if you like them, and walnuts to get more omega-3 fatty acids in your diet. To reduce your omega-6 intake, you want to minimize your intake of refined vegetable oils. Unfortunately, these industrially produced and solvent-extracted oils are abundant in the standard American diet. They're found in a lot of processed foods, and they're inflammatory. It's best to eliminate these inflammatory oils from your diet. This includes vegetable oil, corn oil, canola oil, soybean oil, and grapeseed oil. Next, you want to avoid any foods that have hydrogenated or partially hydrogenated oils. You also want to avoid margarine and butter substitutes, which are often made from vegetable oils, and deep-fried foods, which expose you to trans fat. It's good to be aware that most restaurants cook with these oils, and it's even present in their salad dressings. Now, what exactly is a hydrogenated fat? A polyunsaturated fat has multiple double bonds. The process of hydrogenation is when we add more hydrogens, getting rid of the double bonds. Hydrogenated or partially hydrogenated oils are found in a lot of processed foods and commercial baked goods. You want to keep these harmful and inflammatory damaged fats out of your diet. Now let's talk about the worst fat of all. Can you guess what it is? It's the trans fat, and it's associated with increased mortality, coronary artery disease, and cardiovascular disease. Anytime you eat deep-fried food in restaurants, like French fries, you're exposing yourself to these harmful trans fats. Let's look more closely at what distinguishes the different types of fats at a biochemical level. Saturated fats have the maximum amount of hydrogens, so they're saturated with hydrogens. They're also classically solid at room temperature, like butter or coconut oil. Unsaturated fats have a double bond. Normally, it comes in a cis configuration, meaning the hydrogens are on the same side of the double bond. If something like high temperature causes this cis double bond to flip so that hydrogens are now on opposite sides of the double bond, we call this a trans fat. Olive oil is a monounsaturated fat, meaning it has one double bond. But did you know that if you overheat olive oil past its smoke point, the double bond will flip and it'll turn into a trans fat? The problem is that the human body is incapable of breaking down a trans fat, so it has a very inflammatory impact on the endothelium, which is the inner lining of your arteries. Now let's switch gears and talk about the healthiest fat, which is the omega-3 fatty acid. When it comes to omega-3s, there's two different categories that I want to distinguish here. The preferred forms of omega-3 fatty acids are eicosapentaenoic acid, or EPA, and docosahexaenoic acid, or DHA. The best source of EPA and DHA is wild fish, and the best vegetarian source is algae oil. These are the active forms of omega-3 fatty acids that your body can use. In contrast, walnuts, chia seeds, and flax seeds have a different form of omega-3 fatty acid called alpha-linolenic acid, or ALA. The problem with ALA is that it's easily oxidized, and it's not the active form of omega-3, so your body has to actually convert it to EPA and DHA. Unfortunately, your body does not do a great job of converting ALA to EPA and DHA. This is why I advise my vegetarian patients to supplement with algae oil as opposed to flaxseed oil. Now let's talk about monounsaturated fats. These are another heart-healthy fat that's found in olive oil as well as avocados. As you may be aware, olive oil is a big part of the Mediterranean diet. The best quality olive oil is extra virgin olive oil because it's less processed and full of polyphenols like oleocanthal. Avocados are a wonderfully creamy and delicious fruit from nature. There was a study published in the Journal of the American Heart Association that showed that people who ate avocados regularly, meaning at least 2 servings a week, had a 21% lower risk of coronary artery disease. In fact, it was suggested based on this study that if you can replace cheese or butter with avocado, this may help reduce your risk of heart disease. Another reason to eat organic as much as possible is to protect your heart and blood vessels from toxins and pesticides like glyphosate. What's shocking is that a large national study done by the CDC, which sampled over 2,000 people, found that glyphosate is present in the urine of more than 80% of Americans. I recommend familiarizing yourself with the Dirty Dozen list and at least buying those items organic as much as possible. I know we've been talking a lot about fats today, but I want to point out that carbohydrates are a big problem in this country as well. The current U.S. food pyramid puts grains at the bottom of the pyramid, encouraging people to eat 6 or more servings of grains per day. Unfortunately, half the U.S. population has insulin resistance or metabolic problems, where eating a lot of grains can be problematic. This is how I would revise the food pyramid. I would put vegetables at the bottom of the pyramid, followed by good fats, proteins, and low glycemic index fruit. By reducing your grain intake, you'll definitely reduce your triglycerides, and it can also help you lose weight and reverse metabolic issues like fatty liver disease and insulin resistance. By eating more vegetables and fruit, you're also going to get more soluble fiber that can help lower your cholesterol. Fruits like apples, pears, and avocados, and vegetables like Brussels sprouts and broccoli are great sources of soluble fiber. In fact, a study done in China that looked at over 100,000 people showed that greater vegetable and fruit consumption is associated with lower risk of cardiovascular disease as well as all-cause mortality. Also, the fiber that comes from vegetables and fruit serves as prebiotics for the good bacteria in your gut microbiome. Now, what about eating oatmeal for breakfast to lower your cholesterol? It's important to remember that oatmeal is a grain, so if you suffer from insulin resistance or fatty liver disease, oatmeal is not the ideal option because it will increase your blood sugar and insulin levels. Not to mention, most people also add things to their oatmeal that also raises their blood sugar, like bananas, brown sugar, raisins, or honey. Once again, I want to remind you that if you have high triglycerides or fasting insulin, you are carbohydrate sensitive. So you need to be careful with these types of foods like bread, pasta, cookies, rice, and alcoholic beverages. You also want to avoid artificial sweeteners. Most artificial sweeteners are sugar alcohols that have negative impacts on the gut microbiome. In addition, a recent study was just published showing that erythritol, which is one of the most popular artificial sweeteners, is associated with an increased risk of heart attack, stroke, blood clots, and death. Now let's grade the fats and list them from best to worst. Omega-3 fatty acids from EPA and DHA like wild fish gets an A. Monounsaturated fats from olive oil and avocados also gets an A. Omega-3 fatty acids from ALA such as walnuts, chia seeds, and flax seeds gets a B+ because they're more likely to oxidize and they convert poorly to EPA and DHA in the body. Clean saturated fats from grass-fed butter or grass-fed beef gets a B. Vegetable and seed oils gets a C. Hydrogenated oils gets a D. And last but not least, we have trans fat, which gets an F. As you can see, these are two vastly different options, French fries versus a baked potato. One will expose you to harmful trans fats. This is why I order a baked potato in restaurants, and I enjoy it with just salt and pepper, and of course I get it with grilled salmon and broccoli. Now let's talk about exercise. Exercise is a great way to strengthen and protect your heart for a number of reasons. First, it raises your HDL, or good cholesterol. Second, it opens up insulin receptors in your muscles, helping to reduce your insulin level. Third, it reduces inflammation in your body, which we can measure with the high-sensitivity C-reactive protein. Fourth, it reduces your blood pressure. Not to mention, it reduces your stress levels. So overall, exercise is a great way to reduce your risk of cardiovascular disease. You want to exercise at least 30 minutes 5 days a week, and your goal is to get your heart rate up to 85% of your maximal heart rate. If you're a smoker, you definitely want to quit smoking. When you inhale cigarette smoke, you're exposing yourself to caustic material and radioactive isotopes that's like poison for the endothelium of your arteries. Smoking rapidly ages the inside of your body, and it's one of the worst things for your heart. Now you may be wondering, what are the best vitamins for my heart? Great question, let's go over this. I recommend supplementing with omega-3 fish oil, which remember has the best kind of omega-3, which is EPA and DHA. To avoid any mercury, our fish oil is made from anchovies, which are a very small fish, and it's also third-party tested to ensure there's no mercury. Fish oil helps to lower inflammation in your body, which is your high-sensitivity C-reactive protein. It also helps to lower your triglycerides. I recommend taking 1 to 3 capsules per day, and the great news is our fish oil is really well tolerated and it doesn't cause any fishy burp. Next, we have vitamin D3 with K2. In fact, observational analyses on over 33 studies with over 500,000 individuals suggest that a lower vitamin D level is associated with an increased incidence of coronary artery disease, stroke, and all-cause mortality. Vitamin D3 is so important for so many different aspects of your health that it's now considered the longevity hormone, as I mentioned in my last video on longevity. You want to get your vitamin D level optimized to a goal of 60 to 80 on your blood work. Make sure your vitamin D3 is paired with K2. Vitamin K2 is really important for your heart because it directs calcium to your bones and keeps it away from your coronary arteries. Next, we want to promote methylation, which is a detox pathway in every cell of your body, and we can do this with methyl B complex. Methyl B complex is the energy and stress vitamin, so everyone can really benefit from it. It also helps to reduce your homocysteine on your blood work. Remember, high homocysteine is associated with an increased risk of cardiovascular disease. I like to help my patients get their homocysteine down to an optimal level of 6. Finally, an added bonus is that methyl B complex helps to reduce your carb and sugar cravings. Next, I recommend magnesium, which I call the calming mineral. Magnesium is good for your heart because it helps to relax your blood vessels, helping you to maintain a healthy blood pressure. It can also help prevent palpitations and irregular heartbeats. Additionally, magnesium promotes a lot of detox pathways in your liver, and it promotes deep sleep and muscle recovery. Another added bonus is it helps promote healthy bowel movements. Up to 40% of the American population is magnesium deficient, so by supplementing with magnesium at bedtime, you can feel a big improvement in your health. Now you may be wondering, are there any natural supplements that can help lower my cholesterol? Yes, there are. First, we have bergamot. Bergamot comes from a citrus fruit that's native to Italy. You might be familiar with Earl Grey tea, which is also made from bergamot. Bergamot will gently lower your LDL and raise your HDL. In fact, a systemic review and meta-analysis of over 14 trials showed that bergamot supplementation significantly decreased total cholesterol and increased HDL. The other benefit of bergamot is it's very anti-inflammatory and it has no impact on your CoQ10 levels, so you don't have to worry about it affecting your mitochondria. To reduce your cholesterol more significantly, we can use red yeast rice. Red yeast rice is made by the fermentation of a fungus called Monascus purpuris that grows on rice. The active compound called monocolin K works by gently inhibiting the same enzyme that's inhibited by statins, which is HMGA-CoA reductase in your liver. A review article published in the Journal of the American College of Cardiology showed that red yeast rice can lower your LDL by 15 to 25% within 6 to 8 weeks. It also reduces the high-sensitivity C-reactive protein, which is a marker of inflammation in your body. Red yeast rice is best taken at dinner or bedtime because you make a lot of your cholesterol while you're sleeping. When taking red yeast rice, I also recommend taking 300 milligrams of CoQ10 once a day to help support your mitochondria. The great news is that red yeast rice is extremely effective, but it's also very well tolerated. It's good to be aware that many commercial red yeast rice don't have much of the active compound, which is the monocolin K, and they're often contaminated with something called citrinin. Our red yeast rice is grown in the United States, and it's certified USDA organic. It's also tested to ensure it has effective levels of monocolin K and that it has undetectable levels of contaminants like citrinin. Now I want to spotlight CoQ10. I know I've mentioned taking CoQ10 if you're on a statin or red yeast rice, but really anyone could benefit from taking CoQ10, which is one of the most powerful antioxidants for the mitochondria of your cells. CoQ10 is also known as ubiquinol, and unfortunately your levels decline as you get older. CoQ10 has many beneficial effects on your heart, brain, muscles, eyes, mood, hormones, and even skin. It can also help you maintain a healthy blood pressure and prevent headaches. Next, I want to highlight one of my favorite supplements for metabolic health, which is berberine. Berberine comes from the root of a plant with bright red berries. Berberine works by activating an enzyme called AMP kinase, which has been linked to a lot of your longevity pathways, and this opens up your insulin receptors and promotes glucose uptake. Our Berberine Pro has both berberine and a powerful antioxidant called alpha-lipoic acid. By improving your overall metabolic profile, berberine also improves your triglycerides and LDL. But that's not all. Berberine is also very anti-inflammatory, and it has antimicrobial properties, so it can kill bad bacteria and yeast like Candida in your gut microbiome. Speaking of the gut microbiome, it can also be beneficial to supplement with a good quality probiotic as well as a prebiotic fiber to keep your gut bacteria happy. Remember, all disease begins in the gut, so a healthy gut microbiome is important for a healthy heart. Now here we have Carol. Like many of my patients, she wanted to improve her cholesterol naturally. So she cleaned up her diet, started exercising regularly, and took some of the key supplements we talked about today. Within 3 months, Carol's repeat blood work showed significant improvement in her HDL, triglycerides, small dense and oxidized LDL, as well as her inflammation marker or hsCRP. Most importantly, Carol was feeling so much better. She noticed improvement in her mental sharpness as well as energy, which was awesome. Let's summarize the key points from today's video. Remember that your body needs cholesterol for cell membranes, your hormones, your brain, as well as to make vitamin D. Inflammation is one of the biggest root causes of heart disease. The true bad cholesterol is the small dense LDL as well as the oxidized LDL. Carbs and sugars will raise your insulin, which will raise your triglycerides. The ASCVD Risk Calculator is a tool to estimate your risk of heart disease, and the coronary artery calcium scan can tell us if you already have plaque in your arteries. When it comes to your diet, omega-3 fatty acids from EPA and DHA and monounsaturated fats from olive oil and avocados are the best for your heart. Your diet should be rich in vegetables and low glycemic index fruit to get a lot of antioxidants, polyphenols, and prebiotic fiber. Natural supplements to reduce cholesterol include bergamot and red yeast rice. Finally, regular exercise is one of my top recommendations for your cardiovascular and metabolic health. Thanks so much for watching this video. If you enjoyed it, please give it a thumbs up and subscribe to my channel. I'd love to hear all your questions and comments, so please post those below. Thank you again and have a wonderful day.